You're listening to Just Medicine, an equity in healthcare podcast created by medical students in British Columbia.
Hi, everyone. Welcome back to the Just Medicine podcast. I know it's been a while since I've been on, so I'll reintroduce myself. My name is Audrey Esemezi, a second-year UBC medical student, and I love being a part of this podcast and sharing my passion for advocating for health equity and highlighting work being done to improve healthcare for vulnerable populations. I have previously discussed health equity with regards to HIV status, race, newcomer, and refugee health, and today I wanted to discuss an area of healthcare we may not always think of in terms of being vulnerable populations, but it is. Hence why the focus of today is on pediatric healthcare. When I was preparing for this discussion today, my mind wandered to what are some of the relevant concerns or topics in pediatric healthcare today? And of course, there's so much to unpack in this area, from non-accidental injuries to pediatric mental health to the psychosocial implications of developmental disorders, and to even refugee and newcomer neonatal and pediatric health inequities. But one theme that applies to all of these topics and all parts of pediatric care is regarding children's participation in the decision-making of their health care. One thing we learn at school with all child-related topics is that children are not little adults. But does that mean that they should not have the same opportunities for shared decision-making like adults do? To help me understand more about this area, we have Dr. Amarens Matthiesen, who practices as a certified child life specialist in children's hospitals across Canada. She holds a PhD and a master's in child and youth care for the University of Victoria and an undergraduate degree in psychology from the University of Dundee in Scotland, UK. Thank you so much, Dr. Amarens Matthiesen. I'm so glad for you to join us today.
Thank you so much for the introduction and for having me. I'm so excited to be here.
Of course, we have so much to learn from your work. So kind of jumping in, I'd like to ask, would you mind sharing a bit about yourself and your career journey? Of course, whatever you feel comfortable sharing.
Sure, yes. I can expand a bit on what you already mentioned in the intro. So I currently live in Toronto. I'm currently doing a postdoc fellowship at Toronto Metropolitan University in the School of Early Childhood Studies. But before that, as you mentioned, I also worked as a child life specialist during my graduate school when I was getting my master's, because primarily I was always interested in working in a medical setting somehow and combining my interest in pediatric healthcare with supporting children in one way or another. I think I was primarily drawn mostly to the psychological aspects of supporting children. So when I heard of child life as a profession and a discipline, I was immediately drawn to it, and it kind of clicked for me that that is what I wanted to pursue. So I worked as a child life specialist at different hospitals around Canada, including an internship at Alberta Children's Hospital. Then I worked for a bit in Edmonton at the Stollery Children's, and then also at Holland-Bloorview Kids Rehabilitation Hospital here in Toronto. And then I did some volunteering as well at BC Children's in Vancouver and Montreal Children's. So I had, I think, a nice bit of exposure to different healthcare settings around Canada. So yeah, I think I can touch on more as to why I am now more in a research focused role later. But after I practiced for a few years as a child life specialist, I then pursued more of a research direction in my work. So primarily situations in practice really encouraged me to explore those in research. So that's mainly why I chose to pursue a PhD. And I currently also still do some teaching at the University of Victoria as well on the side. So yeah.
Oh my goodness, you have such a rich background
Thank
and
you.
education, and your career is so wonderful, and so much learning about child healthcare is so important to have people like you who are dedicated to that area. And I would love to touch on your motivations for your current switch to healthcare. But before, I think it's nice to go kind of in order of your story. So can you tell us what is a child life specialist and what is their role in pediatric healthcare? Because I haven't heard of it at all in my
Sure.
career. So please let us.
Yes, definitely. And I think this often happens. And among child life specialists, generally, I think most of us are well known with the fact that our profession isn't that well known, even among professionals who work in a pediatric hospital sometimes. So we're very used to have to advocate for our work in a hospital setting, but also explain what we do all the time, I would say. So broadly speaking, child life specialists are psychosocial support professionals who help children, youth, and families cope with the stresses and uncertainties that accompany hospitalization, illness, and disability. And we primarily use therapeutic play and education as well to help children prepare for medical procedures and explain to them what is happening in child-friendly and child-oriented ways. So we use a lot of play to reduce that fear, anxiety that they may have, and clarify any misconceptions as well. And so what I think is unique about child life specialists is I've always found that we're one of the few or only people on healthcare teams that provides that child-oriented lens. Of course, other people like social workers, we have overlapping roles. Psychologists as well do similar work, but I think we are trained very much in adopting that child-oriented lens, being knowledgeable about children's developmental stages, what they're going through, and how the experiences in the hospital setting can map onto those developmental stages, how it can help us explain what is happening to them. So we, in this way, support children and families, but also a big role is to support siblings as well. We often include them because, generally speaking, I think they're often forgotten in the equation and left out often. And what is nice about our work, I think, is that we can spend some time to really also educate and prepare them for what is happening to their sibling, which I think is really important. And the other element I would say too is that child life specialists primarily work in hospital settings. I think most hospitals across Canada, the larger hospitals, definitely have a few working within them. The bigger hospitals have teams as big as 15, I believe, working there. But nowadays, child life is also extending into the community-based settings like dentist's office and child welfare organizations to help children cope with anxieties in those settings as well. So I think it's a really unique role that's, for me, was very rewarding and for a lot of different reasons. But yeah.
Absolutely. That sounds so rewarding and it sounds so necessary in healthcare. And I'm just amazed that this isn't talked about as much. And I'm sorry if it ever feels frustrating that people may not understand your role immediately and like you have to do the advocacy for yourself because just hearing about this, I'm like, this should be like talked about all the time. And people, I love what you said about that child-oriented lens and just that advocating for the child and explaining it to them is so beautiful and so important and so much that they experience. Like I can't imagine how scary it must feel to not be able to just be starting to comprehend general life, and then now you're trying to understand hospital life and what's happening to me, and such a change in like their environment. And I also love that you touched on the siblings aspect as well, because I can imagine it's so hard to be a sibling of a child who's in the hospital, and even there's so many areas to it. So thank you for your work, and I hope like this podcast reaches more medical students and more people to talk about the importance of different roles in healthcare and how it's just, again, that team-oriented approach is so amazing for patients. So
thank you.
Yeah,
I appreciate the encouragement.
Of course. No, I'm like, wow, I would, I'm just amazed, honestly. Like this is something that I would even love to learn more about how to do also. And it's good to know that this is a resource that is improving and is continuing to expand. And I would love by the time I practice to be so well known, because this is such an important role in healthcare.
Yeah, thank you.
Yeah. So what drew you to the field of child health? And I guess, the second part is, how has your career changed since you were working in it? And like, I guess we can touch on now, like the motivation for your current work.
Sure. Yes. So I think I briefly mentioned before what initially drew me to the pediatric healthcare in general was, I think, I've always found it to be such a unique setting, in which, right, there's so many different professionals with different responsibilities, and it was quite a journey for me to really figure out what role I wanted to play, playing around with the idea of going into medicine or not, or psychology or child life. I think, yeah, what really drew me to that was that child-oriented lens, and that you're really able to focus on the child and narrow down on their needs and wishes. But while I was working as a child life specialist, I was also noticing a lot of situations and things that children would tell me, and they would say to me things like that primarily revolved around how they were included in how the care was delivered or not, rather. And I think, unfortunately, what stood out to me was often children expressing their frustration and maybe a sense of confusion around why they weren't included in certain situations. Like, I can remember working with a young boy who's maybe around 12 or 13. He had more of a chronic condition, so he was quite used to being in the hospital. And at one point, he just kind of expressed, why wasn't I included in the conversation that the doctor had about why they changed my medication, because he had also found out that A, his medication had changed, and B, that his discharge date was postponed a bit more than he had hoped. And he was visibly frustrated and confused about why he wasn't involved in that conversation. And that happened more often in my practice. And to me, that not only signified that child life specialists can play a really valuable role in listening to children's frustrations and helping them navigate that, and then setting up those conversations with relevant healthcare providers to make sure that they get the answers to the questions that they have. But it also signaled to me that, right, there's gaps in the way that we deliver care. In as much as healthcare organizations have philosophies like child-centered care or family-centered care, which all are, I very much believe that they're very important and they all sound very nice. I think the way in which they're translated into practice can be very challenging. And because pediatric healthcare is so complex, and so many people are involved, and children have different types of health conditions, health needs. So that then, I think, led to my motivation to figure out why this is still happening and why children were still feeling confused and frustrated about being excluded from decision making. And that then led into my interest in children's rights and what that means in the context of healthcare, and wanting to do more research about it, which is why I explored the topic of children's rights during my PhD, particularly the role that child life specialists can play in facilitating children's opportunities for decision making. And that was done in the context of the Netherlands, by the way, so not in Canada, but still allowed me to also get a deeper understanding of what is happening in Canada and different countries around the world. And that, led me to doing more research, and now led me to my current kind of postdoc position, where I'm focusing primarily on doing more research on psychosocial issues related to children's healthcare, but also related to children's rights more broadly in different settings like education, including healthcare. So thinking about children's rights more broadly.
Wow. I'm just like taking it all in and seeing a lot of that, like of the work that you've done. I was also wondering if your background in psychology also helps you navigate or plays a role in how you navigate understanding children, because you talked about understanding their developmental stages and how that plays out in this healthcare setting. Does that help at all to really understand the mind better in terms of caring for children?
Thank you. I definitely think so, because during my undergraduate education, I primarily focused on developmental psychology and wrote a dissertation on that. And it really allowed me to explore kind of the cognitive functioning of children's minds and how they think and how they explore their sense of self too, right? The theory of mind was hugely interesting to me. And that definitely informed how I was able to learn about child life work and how we can optimally educate and prepare children for what's happening to them, because children of certain ages are in certain developmental stages, and they might have certain issues that are affecting their thinking and development, right? There's this notion, for example, called magical thinking, where for children of around 6 years old, if you tell them they're going for a CAT scan, they might envision a cat, right? They don't know what that means. Or if you're thinking, if you tell a 5 or 6 year old, we're going to do a dressing change, they might think they have to get dressed. So it's, I think as adults, we might not always be very aware of how our language is being understood by children. As a child life specialist, I really like that you're able to sit down with the child and take the time to explore these misconceptions and anxieties and worries, and take the time to explain them to them.
Yeah, and that's so interesting really to think about, because I always find that the first thing that we always talk about is like knowing if the child's in pain and helping the child feel comfortable. But does the child understand? Like that should also be
Yes.
an impact, because I can imagine, if I was that age and someone told me I had to get a CAT scan, I'm like, yeah, we're getting a cat, and it would be scary to enter this room. And I know we are trying to learn about soothing children, but there's also, there needs to be someone whose entire focus and their background is coming in for helping a child go through these stages in
Yeah,
a hospital or healthcare setting. So that's super
exactly.
interesting to consider. I was wondering if you could share with us a little. I know you're currently doing the research, but has there been any topics that have really like have gotten you hooked, or that you've really, or you find that is like really relevant to today's world? I know maybe some things you can't share, but I just love to know a little bit. Yeah.
Hmm. Yeah, you mean in terms of the
Your
research that
current,
I've done?
yeah, right now in like because you're working in child rights
Yeah, I
research.
see.
So
Yeah,
yeah.
yeah, yeah. I see what you mean. Definitely. So I think as I've been able to research more around children's rights during my PhD and now during my postdoc, and I've come to really appreciate how children's rights really can be relevant for any space or setting that children inhabit. So, but I think they're particularly important for healthcare settings, for various reasons, and I think it might take me a while to explain. But what really stands out to me right now is that we continue to often, I'm going to generalize this a bit. I think often adults, including healthcare providers, will think that young children and children with disabilities, children with medical complexities, are often deemed as less capable of being able to participate in decision making than those without disabilities or older children. And of course, there's some truth to that. Of course, we're not going to ask a 4-year-old if they want to make a decision on whether they want to have surgery or not, right? Because those types of decisions are often dictated by legal guidelines around medical consent, healthcare consent, and they have certain age regulations associated with that. But I think what I am really trying to promote through research is the idea that maybe if we are a little bit more reflexive and critical around how we think about children's participation in decision making, um, that young children can also participate in decision making, right? We just need to adapt the ways in which we encourage them to participate, and it means that we might have to rely more on play-based approaches. It means that it might just take a little bit more time to sit down with them, play with them, understand what's happening. But I think generally, I think it's a bit problematic that young children with disabilities and medical complexities continue to be excluded from decision making, and that we need to, I think, try that much harder to include them, and try to think about the skills that we have and the approaches we're using with children to involve them. And also, I don't think, if we think about children's decision making, we don't always have to think about it as implying kind of that they're always complex decisions that children have to participate in, right? Sometimes a minor decision like asking a child whether they want to sit on mom's or dad's lap during blood work can be hugely impactful for a young child. Whereas we as adults might assume that that's not really important, but essentially in that way, you are promoting their right to be involved and promote their decision making. So I think I'm trying to promote the idea that all children can participate in decision making, and we just need to adapt our ways of involving them and be a little bit more creative in doing that.
Yeah, flexibility
Yeah.
and really having that adaptive skill is super important in healthcare, and
Yeah.
especially in the direction that I'm hoping healthcare is moving in towards, like having equitable approaches for all patient populations. And like that's
Yes.
that difference between like equality versus equity, and
Yes.
kind of adapting to that child's specific needs and using where that meeting the child where they're at, regardless of
Yeah.
their medical complexities, and including them. Yeah, and it's like
Yeah.
it's our job to be like the thinkers. Well, my job in the future, but your job now,
Yeah.
be really critical thinking and how we can allow patients of from
Yeah.
any patient to participate.
Yes.
And that was so helpful to like really have that hammered into my head. And like, I really like how he's like, it may not be the same as, okay, asking if they want surgery or not, but
Yeah.
allowing them to choose, do they want a pink or a
Yeah.
yellow gown,
Yes.
or where
Yeah.
they would like to sit in the room. Like, and I
Yeah.
imagine that also will translate how they grow up as adults, like learning that they are able to make decisions about their bodies and their health in some manner. I feel like you're preparing children who will hopefully have maybe less trauma in the hospital and less bad
Exactly.
associations in the hospital.
Yeah.
And I think that's so wonderful because you also have to think about how, like, it's amazing that we want them to be healed and to survive physically, but mentally, how is that going to affect them in 20 years? And yeah, so
Exactly. And I think that should be one of the primary reasons for why we should think about children's rights, because
mhm,
we want to optimize the outcomes for children and families in healthcare. And if we can minimize their stress and improve their coping just by changing seemingly simple things in how we care for children, I think it can have very big impacts on children's ability to cope and their health and well-being in healthcare. So the reasons as to why I think we should adopt a more child rights centered lens in healthcare
mhm,
are important. And I think children's rights in general, as you were talking, it reminded me that I think there's often a lot of maybe misconception or unawareness around what children's rights really are.
mhm,
And for example, in my current postdoc, we've interviewed different healthcare professionals, and also during my PhD, I interviewed child eye specialists, physicians, and really tried to have conversations around children's rights and how they understood children's rights. And this overarching recurrent theme is that we don't really know what it means, and we don't really understand why we should be actively incorporating this in practice. And I think that the way in which healthcare providers are educated, maybe there's room to include more information there on children's rights and communicating with children and families and how we can integrate children's rights in that communication. Perhaps it made me think that perhaps there's a gap there, that healthcare providers of different disciplines maybe aren't educated enough on what children's rights mean. And maybe I should explain too that when I talk about children's rights, I'm primarily referring to how they're outlined by the United Nations Convention on the Rights of the Child, which is a legal international treaty that was adopted in 1989. And it outlines 54 different articles that broadly emphasize why and how children should be protected, and that they should have the right to participation and provision of information. So protection, provision, and participation are often encapsulated under the 3 Ps. So I think it's a nice way to remember what children's rights stand for, right? So it stands for protection, provision, and participation. And I think that if we think about children's rights as providing this overarching, practical, conceptual framework for raising our awareness of what children's rights are and why we should be incorporating them, we're also recognizing that these rights apply to all children, right? Regardless of their background, abilities, or capacities. And in that way, I think that children's rights also inherently promote a more equity and social justice-based lens, because the 54 articles, they all speak to children's protection, provision, and participation in different settings, right? So it includes children who may be in war-torn areas. And there's a specific article that speaks to the fact that children who are affected by war have the right to protection. They should also not be asked to be involved in the war as child soldiers, for example, right? So it speaks to children in different settings. And in hospitals, if we think about children's rights, there are certain articles that come to the forefront, like the need to involve children in decision-making and their right to have access to information and to receive that information in child-friendly and understandable terms. So I think, as I mentioned before, I'm just really passionate about raising our awareness of the importance of these rights and how they can actually benefit not only our practice as healthcare providers, but also enhance the outcomes of children and families directly. Yeah.
I could listen and learn from you for hours. Just your mind and how you just conveyed everything it just honestly moved me and made me want to do better and learn better about advocating for children and children's rights. And like, I'm even gonna just really look up the UN like definition. It's so interesting you brought that up, because I'm always talking about rights and different things, but it's hard for some people to explain to like me as a medical student, like what are those rights? And like, I hope to have those in your head. Like those 3 P's are gonna stick with me.
Great.
Protection, participation, and provision, and like use that to guide your best practices. And so thank you for sharing.
So glad.
Oh, your work and your everything you do is so wonderful, and how you explain and advocate for children is wonderful.
Thank you.
You've kind of touched on this and talked about healthcare professionals educating themselves and improving communication, but I was wondering if there are other strategies or approaches you would like to encourage healthcare professionals to adopt to be more attentive and responsive to children's rights in a healthcare setting.
I think that's a great question. And I think there are many answers that I can think of. And maybe to try and keep it somewhat short, I think first and foremost, I think it's important to maybe not be afraid to use children's rights language and try to understand what it means for yourself and reflect on how you may be actively promoting children's rights in your practice or not. And maybe also reflect on, if you're not, why that may be. And maybe also remember that promoting children's rights can manifest itself in small acts that can be very meaningful to children and actually have significant impacts on their ability to cope with healthcare. So, for example, being asked questions like, how are you doing today? Or being asked about their hobbies. Or I'm also now thinking of work that has been done by my colleagues in the Netherlands. They did a study where they asked children, like, what would you like to see healthcare providers do more or less of? And one of the big things that came to the forefront for these children was that they found it quite maybe upsetting is the word, or it negatively impact their well-being if healthcare providers stood at the bedside and talked down at them rather than sitting on a chair or sitting on their bed at the side, right? So even little things like standing up versus sitting down can mean very significant things to children. So not being afraid to maybe think more critical around what children's rights mean, incorporating the actions that go along with children's rights in your work. Also using play-based approaches, I think, goes hand in hand with all work that we do with children. One thing that also comes to mind for me is, yes, although it may take a little bit more time maybe to sit down with a young child and try to engage them in play to get a sense of their understanding or needs or misconceptions, At the same time, it doesn't always have to be that time consuming for healthcare professionals to promote children's rights. Depends, right, on how you're trying to do that. I think from research that I've done and I'm currently doing, that's also an overarching theme, is that healthcare providers are too busy. We don't have the time to do this, right? We don't have time to think about children's rights. We don't have time to sit down with each child individually, which I can completely understand. But at the same time, there's different ways of doing this. And I think something else, I think maybe also familiarizing yourself with research that has been done around communication, patient-provider communication in pediatric healthcare. There's lots of great research that actually speaks to more practical strategies that you can use to involve children. So I'm also reminded of work that is being done in Denmark. There's really wonderful work being done, I think, in a lot of European countries who are, I think, maybe quite progressive in their thinking around children's rights, and they are not afraid to implement these things on an organizational level either. So I think there's huge progress being made there. And there's also a study there by, if any of you who are listening are interested in looking it up, it's by Jacob Thestrup, and it's in the European Journal of Pediatrics. And they explored children's perceptions of healthcare professionals, similar to the Dutch study that I just mentioned, and specifically related to that communication and how healthcare providers are educated around communication in pediatric care. And they list lots of practical strategies for young children, older children, around building relationship and trust, kind of healthcare professionals' attitude and appearance. And I think, it's worth delving into that literature to try and get a better sense of what children have told us around what they need and want.
I'm definitely looking that up immediately after. I even had started before this reading a bit some of the work you've done in, regarding children with disabilities and the experience of exclusion. I haven't finished reading it, but just it is that learning from other people, learning from other healthcare systems, that is such a big theme that enriches healthcare and like makes you feel more motivated. Like I feel more motivated after just a little bit of time talking to you.
I'm
and
so glad.
So much to learn from other people.
Yes.
And so much to learn in general, and to keep having that humble spirit to adapt and to be flexible and put patients first, essentially, and however that looks like. I was wondering, just so, because I wanted to steal some of these strategies,
Sure.
if you had any specific examples of play-based approaches that you've used when you were working with children. So something maybe myself or other medical students could learn, and whenever we're in pediatric rotations. And I think we get more time, for example, in like clerkship to spend with patients. So if there's some things that you've tried, maybe it could help us someday. I'd love to know if you feel comfortable.
I think something that comes to mind immediately is whenever we or I would try to help prepare a child for a procedure or help them cope with certain medical procedures, we would often use medical dolls that they can keep, and it's theirs to keep. But we would, for example, if I would need to prepare a child for inserting a G-tube, we would insert an actual G-tube into the doll and talk through what the steps that might be involved with that with the child, and the child could actually do that themselves. They could take control of that. And by doing it themselves and having a child life specialist there explaining the steps that are involved with that, the child is also kind of manipulating the equipment themselves and gaining control over it in a sense. So I think anytime you can maybe adapt medical equipment or introduce them to medical equipment so that they can get a sense of what it is and they can ask their questions in that way. I'm also reminded of, for example, when a child would have to undergo surgery, we would get the anesthesia mask that would administer the oxygen or anesthesia gas beforehand, and we would decorate it together with stickers and personalize it. And during that time, children would then often naturally, I think, bring up their worries or fears around the procedure, and then we could help to clarify those, and again, provide that education, preparation to help them be more prepared for procedures like that. So I think anytime they are able to visually see some kind of medical equipment, like an IV or the anesthesia mask or a G tube in itself, is hugely beneficial. And yeah, using play. I think it also depends ultimately on the interest of the child, right? And sometimes there might be some that love doing art. Then I would actually use drawing or painting to explain certain concepts or scenarios. Yeah, I think it depends. But generally, those are some strategies that I just described that I think child life specialists often use in their work.
Okay.
Yeah.
Stolen.
Great.
I also like that in those play-based approaches, like you're also creating space. So like when you're like playing or doing the thing with them, that's when children often bring up like, what if this happens? Or I was
Exactly.
kind of thinking I was scared. Like that's often how you get to know children, like having that
Yes.
space and time to interact with them. So that
Yes.
makes sense. And it actually just made me think of like, I believe like your work is kind of the foundation of this organization I'm a part of at school, where we go to elementary schools and read to children, but we also kind of explain what an injection is and what an
Oh,
X-ray is. And that like that literally parallels. And I didn't, this is an organization that's
amazing.
already started, but that it sounds like that's exactly like the foundation on which it's built and explaining
Yes.
healthcare to children that creates positive interactions so that in
Yeah.
the future, if they do have to get an X-ray or something
Yeah.
like that, they've already had some positive association with it that can help
Yes.
reduce any trauma, hopefully, that
So
they experience.
you're already doing this work.
I didn't even realize. I was like, makes sense. Like I joined it because I think it was a great opportunity to connect just in the community, and I've always loved working with children. I used to be a
Yeah.
summer camp counselor for like 7 years, and I have a
Amazing.
brother who's just, well, he's grown up, but he was so cute and adorable.
Oh,
Always like loved children and interacting with them and connecting with them. So that just reminded me of like, yeah, why
yeah.
those organizations, although it seems like fun, but it's really important to like letting children
Yes.
feel, even like I would be like, this is a reflex hammer. And then they're like, what's a reflex hammer? And it forces me to understand how to explain things
Yes.
that isn't just reading straight off a lecture slide, but really, do I understand what I'm
Yeah,
saying? And do they understand what I'm saying? And yeah.
exactly.
So, can you share insights from working with children who have medical complexities and how healthcare systems can better support these children and their families?
Yeah. I've I was fortunate enough to work with several children with medical complexities in different hospitals, and I think those were some of the most rewarding and insightful experiences that I had in hospitals.
Mm,
Simply because I think that the needs and healthcare experiences of these children can be, as you know, as is inherent to the name medical complexities, their needs and experiences are also complex. For example, I remember a time when I was able to support a young child who was Indigenous, but was also in need of a medical foster family, who, as a result, spent quite a long time in the hospital, which actually wasn't medically necessary, but more necessary because they couldn't find suitable foster family for her because of her complex medical needs. And having supported that child, it really got me thinking, right, what the impacts of that are for children. As you can imagine, being in a hospital for months to even a year or longer sometimes for these children, while maybe not being medically necessary towards the end of that admission, can have real implications for their health and well-being. But then also that situation in particular really highlighted the significance of social determinants of health, and how they are showing up in healthcare, right? So this child who was Indigenous, the care had to be very closely collaborated, if you can say that, with the Indigenous community that she came from, right? So preferably that medical foster family was also a part of that Indigenous community, but that was proving to be more difficult. And so that then led in a very long admission for this child. And that then made me think, right, there's so much more to healthcare than just the physical health delivery, the delivery of care. There's all these social determinants of health that play a role. And I saw how hard the social workers at this hospital worked to deliver care for this child as quickly as they could. But I think ultimately, children with medical complexities often have longer healthcare journeys and hospitalizations. They're often recurring and frequent, and often also spread out over multiple hospital systems or hospitals around the country. Sometimes they need specialized services from one hospital and another service from another. And that means that healthcare teams have to collaborate and communicate and make sure that the care is delivered as efficiently as possible. And at the same time, we need to keep track of how the child's doing and feeling within all of this. And often, in my experience at least, these children also use alternative communication devices. They may not always participate, for example, in decision making, as I like to focus on, in verbal ways. And that might mean that we then rely on understanding how they use their communication device or how they communicate with their caregiver, and how we can tap into that to make sure that we are accurately meeting their needs. So overall, I think care is quite complex, and these children in particular, I think, deserve and need specialized attention for that reason.
Absolutely.
Yeah.
Thank you for sharing that. And definitely it's a part of healthcare that is so relevant and so important to continue improving.
Yes.
I definitely, as you've alluded to, it's not where it needs to be, but that attention and care and continuously working to give that specialized attention, that is that equity piece, and provide, they have complex needs, and so you need to have complex care available, and however that looks like to meet each of those needs.
Yes.
And so just to I like to wrap up with just asking for advice from our guests. So I was wondering, what advice would you give to aspiring child life specialists or healthcare professionals who want to champion children's rights and equity?
I think something that has stood out for me in doing research around children's rights, and in turn heightening my awareness of the complexity of pediatric healthcare, is that there's huge value in starting with ourselves and examining, maybe critically exploring how we show up in our practice and what biases and values and experiences inform the work that we do and the way in which we do our work. So critical self-reflexivity in that regard, I think, is very, very important in the work that we do, regardless of the discipline that you're in, because I think it might help you understand better how maybe you're responding to inequities in practice, or what you may find particularly challenging about it and why that may be, and what kind of beliefs maybe or experiences may be shaping that. And I think I previously mentioned this too, is that in addition to self-reflexivity, maybe familiarizing yourself with what children's rights mean to you. What are the legal guidelines that exist in your province, which you may, as a healthcare professional, already know, but maybe refresh yourself on what it may mean for children's decision making. And for example, if the legal guidelines in British Columbia, if they say, for example, a child who is 12 needs to have the consent of a parent as well as the assent of a child, maybe just think about how you're getting assent from children and how you're approaching that, and how that is rooted in children's rights. What is the value of children's rights for your practice? And then I think to touch on what I mentioned earlier around self-reflexivity, I think that is also particularly important in working with and caring for children from underserved communities or equity-deserving groups specifically, because it starts with an awareness that these inequities are still happening, but also then inviting a response from ourselves in terms of how we're actively trying to mitigate the negative impacts of these inequities in practice. So I think those are two primary things that stand out to me that I would like to share with others in the field.
Thank you so much for the wonderful advice and that focus on self-reflexivity. Yeah, there's so much improvement that comes even from like when I think of what I think about at the end of the day and how I want to do better. So I totally see how that is something you can focus on if you want to get better in providing pediatric healthcare and providing equitable pediatric healthcare,
Yes.
especially for underserved groups of children and families, and making sure you're meeting the needs and improving our healthcare system. So thank you so much,
No
Dr. Amarens
problem.
Matthiesen, for joining us today and for providing this important discussion. I know your words will stick with me, and I hope it'll stick with me for as long as I'm in a healthcare setting. There's so much to learn from you and others working in this field, and I really appreciate your time.
Thank you so much. It was great to be here. I'm appreciative of the opportunity, and all the best to you and your work.
Thank you so much. Take care.
Thank you.
Thanks for tuning in to Just Medicine.